present to you all. Obviously, I don't even know if anybody I can even talk. I don't know if anybody was able to attend the meetings yesterday, but I was on site, so it was really great to be out to meet everybody that was there. But it's nice to be able to have this conversation too as well. Cece, can you do me a favor though? Because this isn't the right, not the right, but the same link. I can't record. So once I bring the presentation up to the screen, do you want to start recording so we can have the link?
I already started. I got you.
All right. All right, perfect. So just give me a quick moment and I'm going to turn off my camera just so it's not distracting while we do walk through the presentation together. So just bear with me real quick. And then can everybody see my presentation? Or at least.
Yes, we can. Mm-hmm.
Okay, perfect.
Yes.
Great. So I will get started. All right. So once again, good afternoon, everyone, and welcome to your 2025 open enrollment. My name is Beth Jermo Brown. I'm an account executive with Brown & Brown, which is your insurance broker. Thanks again for the introduction, Scott. In terms of your employee benefits broker, I'll be guiding you through your benefits presentation today. So as we walk through the presentation together, please feel free to use the chat function to ask any questions throughout the session, and then we'll take time at the end to address them as well. So let's get started. So we're going to walk through the open enrollment timeline and the action steps of this year's open enrollment. So open enrollment started yesterday, Wednesday, April 2nd, and it will end at 11:59 on Sunday, April 13th. Your plan year will run from May 1st through April 30th, 2026. And like Scott had mentioned, open enrollment happens only once a year, and this is your opportunity to review your plan options and make changes to your elections. This year is an active open enrollment, which means you will be required to enroll and/or waive coverage. If you waived before and you'd like to enroll now, you can. If you're currently enrolled and would like to make a change to a different plan or enroll in a new plan, now is your chance. And you can also make changes to which dependents you cover. So once open enrollment ends, your choices will be locked in for the next plan year. Because your payroll deductions are taken out on a pre-tax basis, the IRS says that the employees are not allowed to make changes to their benefits outside of your annual open enrollment. The IRS does allow a few exceptions to this rule. So if you experience a qualified life event status change, then you will be allowed to make certain changes. Some examples of these include a change in your legal marital status, change in number of dependents, change in employment status, or dependent satisfies or ceases to satisfy eligibility requirements. If you do have a qualifying event, you only have a small window of time to request a change. You must let Human Resources know within 30 days of the status change. And if you miss that 30-day window, then you will not be allowed to make a change to your elections until next year's open enrollment. Now we'll walk through what is new for 2025. So the medical plan options will be reduced from 3 plan choices to 2. So the Healthy Blue Living 1000 plan will no longer be offered. The other plans will continue, however. Option 1 is your Blue Care Network HMO Healthy Blue Living plan. There are no changes to this benefit. Option 2 is the Blue Cross Blue Shield of Michigan PPO Simply Blue 3000 plan. There have been some slight tweaks to the plan design. The office visit copays for primary and specialist care will increase by $10, from going from $30 to $40 for primary care and $50 to $60 for the specialty care. There are a slight change in the tier copays for prescription coverage, but all other benefits in this plan will remain the same. You'll be able to see all the plan design changes as you walk through your Employee Navigator workflow. For the dental plan, both dental plan options will continue to be offered without changes to cost and/or benefits. The DHMO Guardian plan will remain the same, as well as the PPO Guardian Dental Guard Preferred Network. The vision plan, Guardian Choice Vision Network, is renewing without changes to cost or benefits, and this plan is powered by BSP Vision. The Flexible Spending Account, the FSA, continues to be offered through iSolved with these IRS updates. The 2025-26 annual maximum contribution amount is increasing to $3,300, and the carryover amount allowed increases to $660. The Dependent Care FSA continues to be offered and administered through iSolved as well. There are no annual maximum contribution amount changes, and it still stays at the $5,000 mark. We'll talk a little bit more about these plans as we get further into the presentation. The disability life insurance will continue to be offered by Guardian. The voluntary short-term disability is a employee paid product that actually went live in August of this last summer. So anybody that was enrolled came onto the plan at that time, you were able to enroll guaranteed issue, which means no medical questions. Anybody that did not enroll at that time, if you walk through your employee navigator workflow and decide to enroll for this open enrollment, this plan year starting May 1st, you will be subject to evidence of insurability. The long-term disability is an employer paid product from AFG, as well as the basic term life and AD&D benefit. The voluntary supplemental term life will continue to be employee paid. Some additional voluntary plans include the accident and critical illness. Those are all renewing with no plan design changes or cost changes, unless, for example, the critical illness is an age banded plan. So if you'd enrolled in the past, you might be hitting a new age band for this enrollment, but you'll be able to see that in your employee navigator workflow. A new plan this year that we're really excited to offer is the hospital indemnity plan. This is a benefit that pays a cash benefit directly to you in the event of a hospitalization. And we'll talk more about this in a future slide. Additionally, why this open enrollment is active as well is that Guardian is offering a one-time true open enrollment for all their voluntary plans, which means that eligible employees will be able to elect coverage or increase coverage up to the guaranteed issue amounts without having to answer a medical questionnaire or submit evidence of insurability. This is a one-time offer for this open enrollment, but in addition, this applies to the following plans: the voluntary short-term disability, the voluntary supplemental life, critical illness, and hospital indemnity. The voluntary accident plan never requires an EOI, but it must be stated that employees that were previously denied coverage are not eligible to waive into the coverage options, but must submit evidence of insurability. So those two plans that this affects is actually the voluntary short-term disability. Like I mentioned, if you didn't enroll when it was first offered back in August, you will be subject to evidence of insurability, as well as the voluntary life. If you were denied in the past, you will have to submit evidence of insurability. So when you walk through your employee navigator workflow, there'll be a link that you can pop out into, and it's just a brief medical questionnaire that you fill out, and then you go from there. And just as a quick note, neither of those two plans that are subject to evidence of insurability, they'll pend in your employee profile until approved by Guardian. Once approved, that's when you will be initiate that premium payment. So you won't be charged for either of those plans while it's being reviewed for approval. The employee assistance program through Guardian is by Uprise Health. The EAP benefits will continue to be offered without any changes to the plan. So this is a great option that's offered at no cost to you. We'll talk a little bit more about it as we get further into the presentation. So let's talk about some important eligibility information. Full-time employees defined as working as a minimum of 30 hours per week are eligible to participate in the benefits program. Your eligible dependents include legal spouse and dependent children. Dependent children are eligible to remain on your medical, dental, and vision plans until the end of the year in which they reach age 26. New hires, your coverage for you and your eligible dependents will begin on the first day of the month following 30 days of full-time employment. During the annual open enrollment period, you may make changes to your benefit plans, elections, and or family members you cover, but changes can only be made outside of the annual open enrollment period if you experience a qualified family status change, which we talked about on a previous slide. So please reference your benefit guide, which will be located in your Employee Navigator platform as well for additional details on your eligibility. So let's pop into Employee Navigator. So the 2025-26 plan year is a required active enrollment. All employees electing or waiving coverage must do so on this platform. You must complete the Employee Navigator elections. If not, where possible, you will default into prior choices. So for example, that would be something that's an employer paid product. You'll be automatically enrolled in those. If you do not enter Employee Navigator to make your 2025 elections, your previous elections will roll over into the plan year, but this is your opportunity to actually get in there and enroll, and we encourage you all to do so. You'll receive an open enrollment notification from Employee Navigator to the email address on file. Everyone should have received that email yesterday. If you did not and you haven't seen it yet, please reach out to Cece or anybody on our Brown and Brown team, and we'll check the system to make sure that we can shoot that back out to you so you have an opportunity to enroll. Since this will be your first time enrolling in the platform, you'll need to use your unique company identifier to register in the system. You'll need to have social security numbers for any eligible dependents you're enrolling in medical. And then the website, because this is a little bit different, there's not an app for this program. You can use your phone or a laptop, computer, desktop, etc. And you can venture out to www.employeenavigator.com. And out there, you actually don't need the link to register per se. You can go out to the website and start the registration process. The unique company identifier for your organization is Alternatives for Girls, but it has to be inputted exactly as it's written. So with the capitalization and the spaces in between. But like I mentioned, if you did not receive your registration link, please make sure you reach out to HR or someone on our Brown & Brown team, and we'll be there to help. So this is actually what it looks like. On the right-hand side, you'll see an image. So once you, it's a visual of what your home screen will look like once you receive the welcome email from Employee Navigator or you venture out to the site yourself. You'll just need to fill out the requested information. And it's important to note that once you decide to register with your username, it cannot be changed. I would like to recommend using your AFG work email, for it's easy to remember. It's not something that you'll forget. And then from the homepage, you're going to click the Start Enrollment. As you can see in this visual, there are 17 steps. So for example, you see how they're notated in yellow? That means that step hasn't been completed. So you'll first start with this personal information page. I really encourage you, if you change your cell phone number or something is changed, even putting a personal email address in here, all this information actually has been imported over from your previous Ben admin system on top of your ADP profile. So for example, this is a great time to check to make sure everything looks good. The system will ask you for your personal information, any dependent information if applicable. After you review each screen, you'll click Next at the bottom. And when you're selecting your benefits, remember the following. If you're enrolling your dependents in coverage, be sure to click the radio button next to their name. You'll see that as you walk through. The dollar amount shown on the page will reflect the cost per paycheck deduction. We encourage you to review each screen and either select or decline the benefit. And if you wish to decline, you'll need to click on why you don't want this benefit and give a reason for the decline on the pop-up window that appears. So for example, if you're covered under medical coverage from a spouse or another source, say for example, you're still on your parents' plan, you would just click that do not, oh, I apologize. You don't want this benefit, and then the pop-out screen will show all the different reasons why. So you select the reason that's most appropriate for you. In terms as they scroll through, you just want to make sure everything looks accurate on the enrollment summary screen. So a lot of times, once you get to that screen, you kind of take a look and see how much the entire benefits program is going to cost of all the elections you made. And if it becomes a little bit benefit rich for you, you can click back into any of those screens and make an adjustment, whether you want to decline the coverage or possibly enroll in it. The cool thing about the Employee Navigator program is once you log into the platform and you start your enrollment and say you're like, oh, I don't have time to finish it. Once you log back in, all your previous elections will be saved, so you don't have to start over. We're really excited to have this platform for you for this open enrollment. We hope you enjoy it as much as we do. So let's talk about the 2025-26 medical plan options. So the 2025 medical plan, RX plan comparison. So you have two types of plans. You have the Blue Care Network, HMO PCP Focus Network, and you have the Blue Cross Blue Shield PPO Network. So as an eligible Alternatives for Girls team employee, you have the choice between these two medical plans. We won't spend a lot of time on this page. We'll just share a high-level overview of the two plans. The Blue Care Network HMO PCP plan, how that plan works is typically an HMO plan limits member coverage to a medical care provided by specific doctors, hospitals, and other healthcare providers within its network, except for emergencies and out-of-area urgent care. You must name a PCP and receive medical care first from your PCP prior to receiving a referral to a specialist. Usually the premiums, as you'll see inside your Employee Navigator workflow on the HMO plan, are less expensive than a PPO plan. The Blue Cross Blue Shield PPO plan is a more flexible plan with a wider network of doctors and specialists and out-of-state coverage, but has higher premiums and out-of-pocket costs. You do not need a referral to see a specialist. So for example, Something we always like to note is, say, for example, you're going through a big medical event, maybe a cancer situation, and there's specific doctors that you know that are only in that PPO network. At any time, for example, like say for this plan year that starts on May 5th, maybe this is because you're going through that specific medical situation. You're like, I want to be in that PPO plan, but you have always have the opportunity to go back into to switch plans at the next enrollment. So depending on what you're going through, like in terms of your healthcare journey, can kind of sometimes dictate whichever plan that you would like to choose. As we all know, cost is always a driving factor in why you choose a program, but it's just something to consider that you have the flexibility to change your medical plans from year to year. So let's talk about the Blue Care Network HMO PCP Focus Healthy Blue Living 2000 plan. So we'll continue to offer this Blue Care Network plan. It's a unique wellness-based HMO plan designed to reward you for taking an active role in your health. So the core concept here is you have an enhanced versus standard benefits. So the plan operates on a two-tier benefit system, which is the enhanced and the standard. So if you participate in specific wellness activities, you unlock your enhanced benefits, which significantly reduce your out-of-pocket costs. So for example, you'll see here on the left, your deductible, if you're under the enhanced plan, a single or a family, is $2,000, $4,000. But if you don't complete all the steps to be in that enhanced product, you would be in the standard. So you can kind of see, for example, the premiums on the plan will be the same regardless of which program you're under. But for example, when it comes time to actually use the plan, you'll see that it's a lot more expensive for you out of pocket to be in that standard program. So for example, by participating in those specific wellness activities, you unlock those enhanced benefits. And if you choose not to participate, you'll still have great coverage, but under the standard benefit plan, which has higher cost sharing. So the key benefits of the enhanced benefits under that program is a lower deductible. Like we talked about, the 2,000, the 4,000 for families. The standard has the 4,000, the 8. There's a reduced co-insurance factor. So for example, under the enhanced plan, the plan will pay 80%. You'll pay 20% for most covered services. This is better than the standard 30% you would pay underneath the standard plan. There's a lower out-of-pocket maximum under the enhanced plan. It's $6,600 for single and $13,200 for couples and families. Those are the out-of-pocket because of I apologize. So, however, because of the lower deductible and lower co-insurance underneath that enhanced plan, you're less likely to hit the maximum out of pocket in that plan year. So it's just something to consider. The copays are a little bit lower under the enhanced plan, as well as prescription drug savings. The PCP Focus, an important plan feature, it means you need to select a primary care physician within the Blue Care Network HMO PCP Focus Network. So yesterday when we were on site, we talked a lot about the Blue Cross Blue Shield app. And when you log into the app or the portal, it's going to draw you right into this network. So for example, if you go to search for an individual doctor, you'll be able to see right away whether or not they fall into your network. And because it's a HMO plan, a lot of doctors fall in and out of networks. So for example, if you always had a PCP in the past and you find out that PCP no longer participates, then you may have to go out onto the site and look for another PCP that participates. Another big thing is to call, like if you're looking for a new physician and you want to make sure they participate in the network, they're always going to say that they do take Blue Cross Blue Care Network or Blue Cross Blue Shield. You just want to ask them specifically if they participate. But a really good factor to ensure that they do is to make sure that you look on your app or log into the portal to check to make sure that they're in the network. In terms of preventative care, it's covered at 100% under both plan designs. And if you'd like to find more information detailing specific drug lists and etc., you can visit Blue Cross www.bcbsm.com, and you can use the Find Care tool. You can select the Blue Care Network PCP Focus Network plan, and you can also view the drug lists out there too. So in summary, this plan rewards you for being proactive about your health. It offers significant savings when you participate in the wellness activities, and it's truly designed to help keep your health costs down while providing comprehensive coverage. And we're going to really dive deep into this plan in a few slides once we go over the PPO plan. So AFG is continuing to offer the Blue Cross Blue Shield PPO Simply Blue 3000 plan. This plan gives you flexibility in choosing your healthcare providers. The key features are the in-network versus out-of-network. And this PPO plan allows you to see both in-network and out-of-network providers. However, you'll get the highest level of coverage and pay less when you choose for in-network providers. In terms of the deductible, in-network deductible is $3,000 for individuals and $6,000 for families. This is the amount you pay before the plan starts sharing costs. And in order to hit deductible, those are services like going into the hospital or some types of medical services like CT scans, MRIs. Those are subject to deductible. So those fall under diagnostic services. Everything else like office visits, specialist visits, virtual online visits, those are all subject to copay. After you meet your deductible, the plan pays 80%, you pay 20% for most covered services. The out-of-pocket maximum is $8,150 for individuals and $16,300 for families. And this includes your deductible, co-insurance, and copays. So once you hit the annual out-of-pocket max for the year, you're essentially covered for most procedures moving forward. So for example, if you have a big surgery early in the plan year, you can basically hit your annual out-of-pocket max, and that might be a good time to maybe have a scheduled surgery that you're putting up, or just in general, making sure that you're staying on top of your healthcare needs because you're not going to be paying any more costs. The preventative care is covered at 100% when you use your in-network providers, and this encourages you to stay healthy. The PCP visits are $40 copay and $60 for specialists, and you can see all the details on the prescription drugs in terms of for each tier when you walk through your employee navigator workflow. There's a great tool in terms of when you hit the medical piece of your employee navigator workflow, there's a compare button, and it's actually going to pull up these visuals side by side. So you kind of actually look from side to side and evaluate copays, deductibles, out-of-pocket costs. So it's a really great tool for you guys to determine what's going to be the best fit in terms of the medical program for you and your family for this plan year. And all this information is inside Employee Navigator. There's actually benefits at a glance, and your SBCs are all located there too as well for extra information. So let's walk through the steps of the Healthy Blue Living certification process. So for example, step number 1, you're going to see your primary care provider, and they're going to work through the qualification form. They're going to check off these 6 health measures: tobacco use, body mass index, blood pressure, blood sugar, cholesterol, and depression. So this step is due in the first 90 days. So we talked about this yesterday at quite length. For example, the first 90 days starts, your clock starts on May 1st. So for example, if you just had a physical back on the 22nd of February, you can reach out to your physician and request that they fill out this qualification form for you, and it's electronic. It actually comes from Blue Care Network. And because it's within 120 days of it's within the time frame to where it qualifies because of May 1st, within 90 days of that you can actually use that wellness exam to complete this qualification form. Your PCP will submit the results directly to Blue Care Network using their electronic health qualification form. So then there's step 2, and that's due within the first 90 days as well. You'll be prompted to complete an online health assessment, and this is you taking a simple survey so they can get a clear snapshot of your health. You can receive recommendations for ways to improve your well-being, personalized just for you. So all this is located in your Blue Cross Blue Shield portal, and you can access this too through the Blue Cross Blue Shield app. Step 3. If your qualification form shows a BMI of 30 plus, there's a couple different options. We talked at length about this yesterday too. You essentially have 2 different options here because not everybody is going to be physically able to be able to complete the triple tracker option. So the alternative option to complete this step is the lifestyle coaching. So for example, the triple tracker piece, your requirement is completing 7,000 daily steps, a 15-minute workout, or 15 active minutes, or any combination of the 3, at least 20 days per month. So essentially, once you enroll in the program, a Fitbit gets sent to you, and that's how you're going to track your progress. And those details are automatically sent through the app. So someone on the other end, the consultant on the other end, is going to be able to evaluate if you're hitting those steps of that program. So for example, if that is not something that you know or your physician knows that you're going to be physically able to do, then you have the option of the lifestyle coaching. So you attend one 20-minute session each month with your health coach, and you'll be able to complete that step 3. So then step 4 is if your qualification form shows that you use tobacco. In order to qualify here, you have to enroll and participate in the new Blue Cross Wellbeing Coaching Program by attending one 20-minute session with your health coach each month. So all these programs are listed in the app, but this is a tobacco cessation program. So for example, if it's notated that you are a smoker and a tobacco user, you will have to complete this step. Another, just to piggyback on some of the concerns with this, just so you're fully aware, say for example, your last physical was in September, Blue Care Network doesn't require you to have 365 days of separation between your physicals. So for example, obviously if it was last September, you're falling way out of the qualification day period. So you can reach out to your physician and ask that they schedule you a physical sooner, because you can, after January 1st, each calendar year, you can have a new physical. So that could either be the scenario for you to be able to complete this timeline appropriately. Another thing, for example, because we start on May 1st, if you know that you're not going to be able to get into your primary care physician to be able to get this form completed, let's say, for example, by the 5th of August, all you have to do is call the member support number on the back of the card, and let them know that they're going to know that you're all right in this program right now, or as of May 1st. I encourage you to call them within that first week and let them know, and they'll notate your account to say that, hey, my next wellness visit isn't until August. Please notate and then you can obviously request to at the same time, but they're going to put a note on your account, and they're going to work with you to make sure that you can participate and get those enhanced benefits. Blue Care Network wants you to be if you're choosing to take this plan, they want you to be able to be in this program and be successful with it. So they're going to work with you. If you guys I'm going to walk through a couple slides with FAQ questions, but if you have any more questions regarding how to get yourself into this enhanced benefit, please reach out to CC for help. Kick that question over to us. We really want you to be successful and be able to, if you're enrolling in this plan, we want you to be able to be in that enhanced program and receive all the benefits and the cost savings associated with it. So on the next couple of slides, these are some FAQs. So for example, question number 1, who has to complete the plan requirements to qualify for the enhanced benefits? It's only you as a subscriber in the plan. Your spouse and dependents don't need to complete the task, and they're all assigned to the same benefit level as you. So for example, if you're currently in the standard benefit level, how can I earn the enhanced benefit level in the new plan year? Yes, you can. Once you move to the standard benefit level, you'll remain there for the rest of the plan year, but you will have the opportunity to move back to the enhanced benefit level in the new plan year by participating in the required activities and the designated timeline. Blue Care Network will review your account again, and after 120 days to see if you met the requirements. If you did, your status will be changed back to the enhanced with a retroactive effective date back to the beginning of the plan year. So for example, you guys, like say that 120 days pass and you had a couple of doctor's visits, maybe you had hospitalization. Once your plan is notated for being in that enhanced benefit level, all your EOBs will be retroactively updated to show like where you're at in your annual out-of-pocket max and deductibles for the plan year. So all your claims will be reprocessed accordingly. This is just very important to note. What if I've already had a visit with my PCP? We already talked about that, and I'm not due for another preventative visit until after the initial deadline. Blue Care Network does not limit the number of times you can see your doctor to have a qualification form completed, even if you're returning to them after a recent physical that was less than 12 months ago. Qualification forms are accepted for an office visit that occurs up to 180 days before your plan year began. Your doctor can still complete the form now, even if it's for a past visit. Like I mentioned before, just call that number on the back, reach out to them, let them know what's going on, and they'll work with you. Which essentially answers the next question too. More information, you can reach out to www.bcbsm.com, and you'll find all kinds of information in your benefit guide that's inside the Employee Navigator portal. They did a quick note though. They did make a big digital plan change. They're moving from WebMD. So anybody that's engaged in this program, they're moving to the new Virgin Pulse platform. This platform is awesome. We have a lot of individuals like with programs with the Virgin Pulse. The plan isn't changing, but how you're going to access and take a look at those tools, it's going to be a lot more user friendly and just a lot easier to navigate within that app and that program. And they got a lot of new cool trackers in there. We've all of us at our firm have seen a lot of this already this plan year. We saw it before it was being rolled out because this is new for 2025, 26. So I really encourage you guys, if you are engaging in this program, is just kind of check out all the tools and stuff that are available for you. So let's talk through the value-added tools and services. So we've already mentioned the mobile app. If you do not have the mobile app already, this is an excellent tool. So you can stay on top of your health, and it's easier than ever with this mobile app. So you can either go to the App Store or Google Play, depending on what type of phone you have. You can do a whole list of things through this. You can find your doctors, urgent care. One of my favorites is you can print your member ID card. This is great if you have dependents on your plan that, because you as a member, and say for example, you're enrolling dependents like a spouse and children, you only get 2 medical cards. That's all you get. And one always gets lost. So for example, what I do a lot is I have the mobile app, so I download my virtual card and then I take a picture and I text it out to everybody that's on the plan. So everybody has their card. And the cool thing is that is when you go into your primary care, whoever you need to show it to, all you have to do is show them that virtual card. They'll be able to take the info from there and you'll be all set. So you don't have to actually worry about having that, your actual hard copy card. Another thing is too, for example, if you switch plans, well, everybody, if you were not enrolled into the PPO plan from last year, the PP, when it comes times for 5/1, it's your new plan year. So you may be receiving a new card. So if it doesn't arrive on time and you have a PCP visit or any visits scheduled, you can access your virtual card through the mobile app. So this will just make it a lot easier for you. So you're not waiting around for that card to be delivered. And you can see your EOBs on there. Another thing we talked about yesterday, on your health insurance, if you want to get to be able to remove that medical access coverage, there's a qualified healthcare letter. If you go into your Blue Cross Blue Shield portal or even on the app, and under the app, if you go under forms, you can actually click on that and there's a PDF of that letter, and that's the letter your insurance agent would ask you for. This is only if you're trying to remove that from your insurance coverage. This is something that changed a couple years ago when they made that revision in the state of Michigan. Before everyone used to have this medical access coverage. Now we have a choice to remove it or not. But if, for example, too, if you have individuals on your healthcare plan and you need a copy of that letter for your auto insurance agent, you might have to call the member services number, but it's super quick. I do it every year. And they'll put the name of the dependents on your plan and their date of birth, and then you get that over to your insurance company. This is just something, I think if you've done this in the past, you'll probably aware of what I'm talking about. But if you have any questions, just feel free to reach out to us. It's just a great way to access that form. Another thing is the virtual care by Teladoc. I love this program because this kind of actually launched very heavily and was utilized heavily during COVID when we couldn't actually go to primary cares and see people in person. This is a great way to get the care that you need to be able to get a prescription called in for you. Saves a lot of time. For example, all you do is you download this app and you set up a call with a doctor, and say, for example, you have bronchitis or something like allergy related stuff, and you don't have time and you can't get into your primary care. You can use this virtual care by Teladoc. They can call in the prescription for you. You just pay your copay and then you just go on, with your everyday life. I like this option too, because if you have bronchitis or something like that, or strep throat and it's recurrent, we know how it works. When you go to your primary care, your appointment's at 3 and you don't get in until an hour and a half later. It's like the last place you want to be when you're sick. So all this information is inside Employee Navigator and your benefit guides. So they have QR codes and everything, so you guys can download these apps. And then your virtual visit, it's the same cost as your primary care visit too as well. This Price Edge, this is a great program. What it does, it helps you to be an advocate for the costs that you pay for your prescription drugs. You're able to go into Blue Cross Blue Shield. You select My Coverage and you can search your prescription. And what it allows you to do, it basically used to be like the Good RX card. But for example, say you normally go to Walgreens for your prescription. What it's going to do is going to show like your zip code, and it's going to show all the pharmacies around you. So for example, you can compare costs between all the pharmacies, and you can essentially say, okay, well, the Kroger is actually a lot less than Walgreens, or, the Meijer is less than the CVS. So it allows you to just really take control of your healthcare and your prescription costs by being able to research those variations. Just a really great tool if you haven't used it before. Another tool is the cost estimator. This is excellent. For example, if you're having a planned surgery, as you can see in the visual, it's kind of talking through a knee replacement or a chest x-ray. MRIs are a big one for this. So for example, if you have to have a scheduled MRI, a lot of times your physician will direct you to go to, like, say your doctors are in the BOMA network, they'll direct you to go to BOMA, and what will end up happening is you're going to pay a lot more because it's a hospital for an MRI versus a standalone MRI center. So this tool located in your portal, you're able to research all the facilities around you that have these common procedures, and then you can review all the different costs and then see what's going to be the best option for you. It just really helps with your out-of-pocket costs. I apologize, I went a little fast. So the Pillar RX program, this is an excellent rebate program. This is for very high cost drugs. Blue Care Network, Blue Cross Blue Shield reach out to you if you actually qualify for this program. And what it is, it really helps to offset your exorbitant out-of-pocket costs that could be come along with having a high dollar cost prescription. So this is a really great program. They send you information. They send you all the information you need for your discount to the pharmacy. And then, for example, only the amount you pay for your prescription will be applied to your plan's annual out-of-pocket maximum. Because there's a lot of prescriptions out there, like Humira injectables and things like that, are very high cost and cost you as a member a lot out of pocket. So this program kind of comes in the in-between and helps lower that cost for you. It's one of our favorite programs with Cross. They do have some additional programs. Do a quick highlight review on this. You may have never seen these before, but we have the Maven program. This has two facets for it. It's for women's health. Super big fan of this because there's more to women's health than just maternity. It actually has programs and resources for those going through maternity, a maternity journey. There's a website for it, all kinds of advocacy, helps with virtual appointments, etc. And then it has the other side of the coin, so the menopause program. A lot of personalized support for you, like that are going through that journey. Just really great programs in general. Just another resource for you. You can see the website to access it. The IRIS program is the cancer support program. Super important to have as a resource because anyone that's going through a cancer journey, there's a lot of things to consider. So you have dietitian support, goal tracking, you have peer mentor communities, just a lot of great resources, and you can find it there. The Teladoc Diabetes Management Program, usually what happens, how this works is you actually receive a call from this from the representatives for this program because it's going to really help you manage if you're recently diagnosed with diabetes to help you manage your journey. And if you're recently diagnosed, it'll kind of help you with all the different resources. It can help you to kind of get on the other side of that, or just in general, just help you with some of the reports, just all the support that you need for that when you're going through that process, and just all kinds of tools and different things that are there to help you. So these are all offered to you at no cost. So for example, if you're going through any of these types of scenarios, feel free to reach out and log into the portal to take a view of these programs that are available for you. The last one I want to mention is the Blue Cross Blue Shield Blue 365. We love this one. So if you go out to blue365.com, you have to be enrolled in a Blue Cross Blue Shield program, was Blue Care Network or the PPO plan. But it's a savings program. There's tons of discounts out here. There's discounts for fitness. So for example, Platinum Fitness Lifetime, there's discounts for pet insurance. There's discounts for local health, hotel stays. And this is all just for being a member of Blue Cross Blue Shield. So I encourage you guys to pop out there, kind of see what's available, especially if you're in the market for any nutrition products or fitness equipment, stuff like that. Just another cool resource available to you. So I'm going to just pop into the 2025 FSA and the dependent care spending accounts. So for example, the FSA and the dependent care are a way for you guys to put aside pre-tax dollars to pay for qualified medical or dependent care expenses. So the big caveat for this plan year is that the FSA has increased to 3,300. Last year was 3,200. So that's your maximum annual election amount. So how that works is you walk through your Employee Navigator workflow, you'll see the option to participate in this. So for example, if you know say you're on a prescription that requires you to see your doctor every month, or you're going through, have a medical event that you're working with, and you know you're going to have to go to your doctor, or you know that you're going to have a surgery, this is a way for you guys to put aside pre-tax dollars to pay for these qualified medical expenses. So for example, the total amount you can pay is for 3,000 or set aside is 3,300. But the nice factor of this It doesn't only apply for medical expenses. You can use it for vision or dental expenses. So for example, a big exciting day for me and my family is my daughter just got her braces off yesterday, and anybody who's had braces or has dependents who've had braces, we all know exactly how expensive it is. So for example, the year before, I contributed to the FSA because I knew how much it was going to cost. So I was able to take advantage of those pre-tax savings. So it's just some of the things you can consider. Another great feature has a carryover of $660. So for example, say you set aside $1,500 for the plan year and you end up not using it all, and say you had $500 left at the end of April 30th, that $500 will roll over into your new plan year. So you won't necessarily lose those funds. So that's a really important feature and super helpful just in case like whatever you're projecting to use for the plan year didn't actually come to fruition. The dependent care spending account, this is more, for example, when you have children that are still after school services or nursery school, those types of things. This is the type of program for you to set aside pre-tax dollars for that. It does not have a carryover feature, so you do have to use that all within that plan year. The dental and vision, nothing has changed on the Guardian Dental. Just the big caveat here is you have the PPO plan and the DHMO plan. The PPO plan, as long as you stay inside the PPO network, you will not have an annual deductible for your family, and the annual plan maximum is $1,500 per individual. So that's the most that the plan will pay each year for towards your services. There's no waiting for periods for cleanings and basic services. Preventatives covered at 100%. You can have 2 cleanings every 12 months. You just want to make sure that they're scheduled 6 months apart. A big difference between these two plans right here is the DHMO plan. You actually have to pick a primary care provider for that, but there is no annual out-of-pocket max with it. So what that means, if you haven't been to the dentist a while and you know you have a lot that needs to get done, this is a great plan to consider. But the biggest thing is you want to go on guardiananytime.com. And even when you walk through your open enrollment elections, you do have to pick your PCP for this DHMO plan because that is the only person you can see. You can't go to anybody in the PPO network or they'll charge you full price for whatever service you have. All the details are inside your Employee Navigator and you'll be able to compare the plans side by side. The Guardian Dental PPO rollover benefits, if you've been in the PPO plan before, I'm going to be providing a report to CC. So how this works, if you and anybody else on the plan reached $700 in claims last year, and you stayed within that PPO network, up to 350 can roll over into your future year. So what that's going to do is go from your 1,500 annual out-of-pocket max, it's going to bump it up another 350. So you get to use those benefits. Say, for example, you have a tough year where you need a root canal and a crown, you're going to be able to increase those annual out-of-pocket benefits to be able to stretch your dollars towards those dental procedures. This works for everybody that's enrolled on the plan, so I'll have that report for CC this week. So if you've been on the PPO plan for a while, we're going to take a look and see who's eligible for these benefits. The vision plan is insane. It is a Guardian Vision plan, but it's powered by VSP. For example, you can see that there's in-network and out-of-network costs. So for example, if you decide to go to an out-of-network vision provider, you would submit for reimbursement, and the details are all on the right-hand side in terms of how much they would pay. The big thing here is the frequency. Eye exams are once every 12 months. Lenses, eyeglass, or contacts are once every 12 months, and it's 24 months for frames. And you'll be able to review all this inside your Employee Navigator. The employee contributions. Like as Scott had mentioned, AFG, as well as Brown & Brown and Scott and his team, we worked really super hard to really design an affordable employee benefits package for you and to try to keep these medical premiums lower. You'll be able to see what this looks like as you walk through your Employee Navigator workflow, what it looks like actually, when you walk through, it's going to show if you are currently enrolled in the medical, it's going to show what you're enrolled in, and then it's going to compare like what the two options are for you and if you're going to cover dependents too as well. The dental and vision premiums, they haven't changed at all, so they'll all look the same for you guys as you walk through your Employee Navigator workflow. The employer paid benefits. So AFG is very generous with their benefits package. They offer you guys some really great, amazing benefits. So one of them is the basic life A&D benefit. You'll be able to see this. You're automatically going to be enrolled as you walk through your Employee Navigator workflow. Our biggest call out here is to make sure you designate a beneficiary on your enrollment form. Even if you've done in the past, it's always a good thing to check it and make sure it's up to date. The accidental death and dismemberment is included in terms of your basic life amount. So what that means, if you pass away due to an accident, your beneficiary will receive the basic life amount plus that additional AD&D benefit too as well. And more details are inside the benefit platform. Long-term disability is another great benefit that's offered at no cost to you through Alternatives for Girls. How the plan works, it covers up to 60% of your monthly earnings to a maximum benefit of $5,000. If you are participated in the short-term disability and say you ended up in a big medical or accident scenario and you ended up being out longer than the short-term disability plan covers, then your long-term disability plan would come into play. This actually would cover you up to Social Security disability age. So this is a really great paycheck protection program, and we're really happy that AFG offers that to their team members. The EAP, like I mentioned, this is also at no cost for you. This is a really great program. The core EAP benefits include up to 3 counseling sessions per family member at no cost. This can help with stress, anxiety, relationship problems, and grief. It just really helps you address emotional problems that could be affecting your work performance, etc. One of the things I like too is as you scroll down to the lower part of the screen, there's a lot of parenting support here. So parenting and also child and elder care support. There's taxes, ID theft services, all kinds of great things. And this is at no cost to you. I really encourage you guys to take a look at it as you walk through your employee benefits workflow. Just really take a few minutes to kind of gaze it over, because this could be something that would be really helpful for you and your family. The 2025 voluntary benefits. So the voluntary short term, like I mentioned, started with Guardian back in August. This covers 60% of your weekly earnings up to a maximum benefit of $1,500. If you already enrolled prior, you'll see that you enrolled in it right now, and you have the opportunity to enroll in it again. If you didn't, you'll be subject, and you want to enroll for this new plan year, you'll be subject to filling out that evidence of insurability. This is an important program because at the end of the day, we all work really hard for the paycheck, because our paycheck goes to pay for everything else, rent, mortgage, utilities, you name it. So it's just really important to consider, out of all the extra benefits you could enroll in, obviously outside of medical, because we all need that. This is another one to look at, because our paycheck is important to, if we do end up sick or hurt, to make sure that we're not super stressed out and we can get back to work and back on our feet. The life insurance still remains the same. If you elect it before, it will show up in your workflow. You can continue to participate in the plan. If it's your first time, if you're a new employee, you have guaranteed issue options. If you have enrolled in past and you decide you want to now, you'll be subject to evidence of insurability. All the details on the plan are inside your workflow. If you guys ever have any questions, just know you can reach out to us. New this plan year is this voluntary hospital plan. So this is a really great plan to help offset the out-of-pocket costs that come associated with a hospitalization. So for example, if you have a planned pregnancy and you know that, or you're planning on becoming pregnant in the future, this is a great option for you guys to put in place, because essentially the average day is 2 to 3 days when you go in for a delivery. So for example, how this plan would work, that first 24 hours, it's $1,000 admission benefit. And then each day that you're there, it's another $100. So say, for example, you're there for 3 days. That's you submit your claim in your medical paperwork. Guardian pays you. It's $1,300 that comes to you tax-free, and you can decide what you want to do with it. It can use for sickness or accident on this plan. You'll see all the details in your Employee Navigator workflow. The accident plan, this has already been offered in the past, so this is a little bit different. You have to have an accident in order to make a claim on the policy, but there's so many great benefits associated with this. If you have kids in sports, this is a great plan. Basically, it's a little bit different because essentially the carrier pre-numbers every single part of your body. The more important your body part is, the worse you hurt it, the more things they do, then the more cash benefits available. So say, for example, you break your leg, you're going to be in the emergency room, so cash benefit for that. They're going to do an MRI. There's a $200 cash benefit for that. And then if you're there for a day, there's a cash benefit for that. We all know what happens after fracturing a leg. You're going to have PT. So all these different benefits, as you continue to submit copies of your medical paperwork, Guardian will continue to pay for you. You can cover, not pay for you, but send you those cash benefits. You can cover your dependents. All three of these voluntary plans, the hospital, accident, critical illness, you can cover your spouse and your dependents up to age 26. And you'll see all the costs, premiums are as you walk through your workflow. The critical illness is a little bit different. This is kind of for the big stuff, I say. Accidents, we can't predict them. We can't always predict a critical illness event. So how this works is a lump sum cash benefit for heart attack, strokes, cancer situations. There's a brief snippet at the bottom of the slide to kind of show you some of the things it covers in different percentage amounts. The full plan design is inside Employee Navigator, but how it works is, say you got diagnosed with a stage 3 cancer, say stage 3 throat cancer you're diagnosed with, and you had a $10,000 benefit amount. You send in a copy of that diagnostic report. Guardian reviews it. If it's approved, then they send you with that one lump sum check of $10,000. One of my favorite things about this program is the fact you can cover your children up to age 26 for free at 50% of whatever amount that you enroll in. It is age banded, so such as life, the older you are, the more expensive things you can get. So as you walk through, you can kind of see what it looks like. There's like a little pulley, you can go from left to right. So you can go from 5,000 to 20,000, and kind of see how that works out for you. Just want to thank you all for taking the time to join me today as we walk through everything. We know we have busy schedules, and we just really appreciate you guys making this a priority and popping on. This is recorded, so the recording will be housed up in Employee Navigator. You can look at it anytime. Sharon Newmer is your account manager at Brown & Brown. CC knows how to get a hold of all of us. I would like to take the opportunity to open this up for questions now. So if anybody has a question, feel free to unmute yourself